Lies you have been told about the Widal test, popularly done for the typhoid infection. Before we talk about it, I want you to understand what the Widal test is. It is a special test that is done to pick up antibodies produced by a bacteria called the Salmonella typhi and the Salmonella paratyphi, which is the bacteria that causes the typhoid infection. Let me not bore you with those names. You don't really need to know those names. But the Widal test picks up antibodies. You can call them chemicals produced by these bacteria when one is infected with them. Now let's talk about lies that you have been told about this Widal test. Number one, when anyone has fever or headache, it means that the person has a typhoid infection, and quickly the person must do a Widal test. That is a no, no, no. There are several causes of fever and headache, and yes, white typhoid is one of them. It doesn't necessarily mean that you have the typhoid infection. Some of you go ahead and add malaria and typhoid two in one, right? No, it doesn't have to go that way. The second lie you have been told about the Widal test is that when you do this test and then you have high values, you have high titers, it means that you have the typhoid infection. No, and that is why I'm here to talk about it. There are several things that can make the Widal titers go up. Some of you say, they said, I have high typhoid. Okay, that's fine. Before you say you're having high typhoid, let me use the local parlance. I want you to know that the Widal test is not reliable in making a diagnosis of typhoid fever. It's not reliable. This is because there are other things that can make the titers go high. For example, if you have had a previous infection, your titers can be high. It doesn't differentiate a previous infection and a current infection. Now, let me tell you, some people have gotten the typhoid vaccine, and if you check the Widal levels in such people, the Widal titers can also be high. So you see, it does not differentiate previous, current, and those who have been vaccinated with the typhoid vaccine. So the Widal test is not enough to make a diagnosis of typhoid fever. You know, sometimes you even go to the hospital and you speak with the doctor, and the doctor is suspecting some other things, but you say, no, doctor, have you added Widal test? Add Widal test inside. I can see you're guilty of it, right? So please, the Widal test is not reliable at all in making a diagnosis of typhoid fever. Also, a malaria infection can cause this titer values to go up, what we call false positive. It shows that the test is positive, but in the real sense, there's actually no typhoid fever infection. And some of you go ahead and get antibiotics from the pharmacy. And for some people, they are even treating the typhoid every month, exposing themselves to several antibiotics, which is causing the rise of what we call antibiotic resistance in the world, and the world is battling with it. So please do not rely on Widal test alone to make a diagnosis of typhoid, and spare your body of those numerous antibiotics you take even without the doctor's prescription. I hope you have learned a thing or two from this conversation. If you have any comments, please feel free to type it in the comment section. Like and share this video so that we can help many other people. And if you are yet to subscribe, please click the subscribe button.